Can scoliosis be fixed? Have you or someone in your family been diagnosed with scoliosis and you're wondering if scoliosis can be fixed without surgery? Hi, I'm Dr. Gubbels with ScoliCare Denver. Can scoliosis be fixed is a question that I hear every day from patients who feel overwhelmed and unsure really about their futures. So today we're going to explore that question together. Scoliosis is not curable though. However, the size of a scoliosis curve can be reduced in many cases. Additionally, one's physical appearance can often be improved too, meaning how they look on the outside. Now, some of the ways on how the body looks on the outside include leveling of the shoulders, improved posture, such as reducing a lateral shift in the spine, reducing a forward anterior lean where someone starts to lean forward like this, that we a lot of times will see in adults that have scoliosis, reducing what's called scapular winging, where one of the scapula starts to stick out on one side, reducing the severity of rib humping in the spine, also reducing asymmetrical waist, and potentially even reducing other things like anatomical short leg with the corrective lift. What non-surgical treatments can actually effectively treat scoliosis? So there's actually guidelines that have been established through SOSORT, which is the International Society on Scoliosis Orthopedic and Rehabilitation Treatment. Now, SOSORT has established guidelines on the most appropriate and the most effective treatment for scoliosis, including which treatments are appropriate for individual cases depending on the size of the curve, someone's age, and also the risk of progression. Now, treatments like chiropractic adjustments, massage, acupuncture, Pilates, and just general physical therapy have not been shown to be effective in reducing scoliosis or in potentially stopping or slowing the progression of curves. However, they may be helpful in reducing pain, improving mobility, and just improving overall health and well-being. So although they're not directly impacting the curve, they still may be recommended for patients with scoliosis. Scoliosis-specific exercises can be really effective in reducing the risk of curve progression, and in some cases, they can actually reduce the size of a scoliotic curve. Now, there's 4 criteria that need to be met for something to be considered a scoliosis-specific exercise. They are: 1, it must teach the patient how to put their body in a 3-dimensional correct position or autocorrection. 2, it must include strengthening and stabilizing in correction. 3, it must include activities of daily living. And the 4th aspect for something to be considered a scoliosis-specific exercise is it must include education, meaning we have to teach the patients about their spine and what's going on with their spine, because if they understand what's going on with their spine, they will understand what we have to do to correct it. There are several different types of scoliosis-specific exercises. Some of the more common ones are Schroth, SEAS, which stands for Scientific Exercise Approach to Scoliosis, and Chiropractic Biophysics. And now a new, more modern technique called ScoliBrace. Now, most of these techniques have pluses, but a lot of them have some minuses too. What ScoliCare has done is taken the best parts of several different scoliosis-specific exercises and has combined them to create ScoliBrace. And by combining the best aspects of several different methods, we believe ScoliBrace is more effective and more efficient than other results, getting superior results. Another effective treatment for scoliosis is custom bracing. Now, bracing has evolved over the years, and there are several different types of braces that get varying results. But overall, bracing is the most effective non-surgical treatment option for moderate and large curves with a higher risk of progression. Now, the brace we recommend at ScoliCare is ScoliBrace. And there are several reasons that ScoliBrace gets superior results compared to other braces. 1, ScoliBrace has a design and manufacturing process that literally eliminates errors in brace design. Now, most scoliosis braces are designed and made by someone's individual hands, which leads to inconsistencies and inaccuracies when the brace is actually manufactured. And ScoliBrace uses a method using CAD/CAM technology, which means computer-aided design and computer-aided manufacture. By using these advanced and more modern technology, ScoliBrace can ensure that each brace is correctly made for each patient. ScoliBrace also puts the patient in a true 3-dimensional corrected position. You see, other braces use a method called 3 points of pressure, where basically they try to squeeze the spine into alignment on almost like trying to hold it in a position like a cast. You see, scoliosis is a 3-dimensional condition and it requires a 3-dimensional solution. See, ScoliBrace actually works to untwist and unwind the spine, and it works to hold the spine in a true 3-dimensional corrected position. Each ScoliBrace is custom made for each individual patient, so you can be confident that you get a brace that actually addresses your exact specific needs. Now, surgery is appropriate for some cases, but scoliosis surgery should only be used when all conservative methods have failed. So who's a candidate for ScoliBalance and or ScoliBrace? Now, ScoliBalance can typically be used as early as 8 years old, meaning about 8 is usually the earliest we will actually start using that with patients, and also depending on their physical and mental development. And sometimes for smaller curves, we only do ScoliBalance alone when appropriate. Now, ScoliBrace can be used on infants, on children, on adolescents, and adults. So we can use it on pretty much anyone when appropriate. Now, what are the goals of these treatments? Now, the minimal goal for all cases is to prevent surgery. In infants, children, adolescents, the goal is typically to stop the progression of curve, but also to try to reduce the size of the curve and improve aesthetics, meaning improving how someone looks on the outside. Now, in adults, the goal is to reduce pain and slow or stop progression. In some adults that are younger and have more flexible spines, a lot of times we can actually reduce the size of the curve in them as well. So if you found this information helpful, be sure to click on the link below and subscribe so you can be notified when we put out new content. And also, if you found this helpful, be sure to give us the thumbs up. And if you have questions or there's specific things that you would like us to talk about in future videos, put those in the comments below and we will address those concerns or questions in our future videos. And the last thing is, if you want some more specific information on how scoliosis can be treated, just click the link to download one of our free ebooks on treating scoliosis without surgery. Hi, I'm Dr. Chris Gubbels with ScoliCare Denver, and always remember to stay ahead of the curve.